Hello and welcome to my channel. In this lecture, we will learn about blood as a tissue, a liquid tissue present in the body. So it's considered as a type of connective tissue, but in the liquid form. So let's begin. We all know that the blood delivers the oxygen and necessary nutrients and substances to the cells of the body, and also collects back the metabolites or products of metabolism from the cells. The blood is composed of blood cells suspended in plasma. The plasma constitutes 55% of blood fluid, 92% water, and contains glucose, proteins, minerals, hormones, carbon dioxide, and the blood cells. Proteins, multiple proteins present in the plasma, and the most important is albumin, which is the main protein. It regulates the colloid osmotic pressure of the blood, and it's one of the driving forces at the capillary bed. Blood cells are red blood cells or erythrocytes, white blood cells or leukocytes, and platelets or thrombocytes. The abundant of these are the red blood cells. They are concerned in oxygen transport and by reversibly binding to the gas and greatly increasing its solubility in blood. But in case of carbon dioxide, is transported mainly through extracellular path as bicarbonate ion transported in plasma. Blood circulates in the body, of course, after being pumped from the heart to deliver to all the cells of the body, and then returns back of the lung to the lung to be oxygenated and get rid of the carbon dioxide through the lungs. As mentioned before, we're studying blood as a specialized form of connective tissue. Functions of the blood, to summarize: it supplies oxygen to the tissues. The oxygen is bound to hemoglobin, which has ferrous ions in it. Supplies also nutrients and like glucose, amino acids, and fatty acids. They are dissolved in blood. The blood removes the waste products of metabolism, such as carbon dioxide, urea, and lactic acid. It has immunological functions because of the presence of the white BCs. Also, it has a coagulation function to prevent bleeding from broken blood vessels. It's being converted from the liquid form to the semi-solid gel to stop the bleeding. This is, of course, as a result of interaction of many coagulation factors. Also acts as a messenger function because it transmits hormones and signals secreted by damaged tissue to the nearby tissues. It regulates the body temperature, and it has hydraulic functions like what happens in the clitoris and the penis due to the hydraulic effects of the blood. The cells of the blood, in each microliter there are approximately 4.7 to 6.1 million, less than that in males and less than that in females, of red blood cells and the mature red blood cells, they lack a nucleus and no organelles like lysosomes and Golgi apparatus, for example, to make space for the hemoglobin to carry as much oxygen as possible. The red blood cells also have markers on them composed of glycoproteins. They differentiate the blood into the types of blood we know, the A, B, and AB and O groups. Also, some proteins there for the rhesus factor. We will discuss this later in a coming slide. The proportion of blood occupied by red blood cells is referred to as hematocrit. It's about 45%, and this estimate is considerable when talking about anemia. For example, you will find decreased red blood cell mass. So it's an important value, the hematocrit value. Contains also 4,000 to 11,000 leukocytes. They are responsible for the immune system of the body, through which they destroy or remove damaged cells and attack infectious agents called pathogens and foreign substances in the body. Also contains 200,000 to 500,000 thrombocytes or platelets, and the platelets are important in the coagulation process and stoppage of the bleeding from damaged vessels being laid on a fibrin meshwork during injury or right after injury. Plasma constitutes about 55% of the blood. It's a fluid, of course. It's straw yellow in color, and the total volume of the plasma is 2.7 to 3 liters average, and contains around 92% water and 8% proteins and trace amounts of other materials. Plasma circulates with nutrients dissolved in it, such as glucose and amino acids and fatty acids. And the plasma also removes waste products such as the carbon dioxide, urea, and lactic acid. Other constituents of blood: serum albumin, clotting factors of the blood, immunoglobulins, important for the immunity, lipoprotein particles, various proteins, and various electrolytes. The electrolytes are mainly containing sodium and chloride. And the term serum refers to plasma without the clotting factors, with most of the proteins remaining in the serum are albumin and immunoglobulins. Immunoglobulins are antibodies. The pH values, it's important in the process of homeostasis, and it has a narrow range, varies between 7.35 to 7.45. You all know that above 7 is alkaline or basic, below 7 is acidic. So the body pH is kept on the slightly on the basic side, 7.35 and 7.45. The blood pH needs an accurate system to control it, because the narrow range, as well as the partial pressure of O2 and partial pressure of CO2 and the bicarbonate levels, all these controlled by the synchronized actions of the lungs and kidneys. Respiratory system and the urinary system are responsible for acid-base balance of the body. To get an accurate picture of the partial pressures of gases, you need an arterial blood sample, and the arterial blood gas test measures these levels. About cell production, the production is called hematopoiesis. It takes two lines: erythropoiesis for the RBCs and myelopoiesis for the white BCs and platelets. During childhood, it's almost produced in every bone in the body. In adults, it's only in the long bones like the upper and lower limbs, for example, like the pelvic bones like the sternum. And in the child, don't forget the role of the thymus as in the production of T lymphocytes. This is very important. The thymus, you all know that it degenerates around 16 years of age, but still stores a good amount of T lymphocytes. This is a picture showing you the process of hematopoiesis from stem cells. It gives rise to myeloid precursor cells and lymphoid precursor cells. The myeloid precursor cells give rise to the myeloblasts and mast cells, erythrocytes, and megakaryocytes. The megakaryocytes responsible for the production of platelets or thrombocytes. The myeloblasts will give rise to the basophils, neutrophils, eosinophils, and monocytes that will eventually give you the macrophage cells. On the other hand, the lymphoid precursor cells will give you the natural killer cells. They are large granular lymphocytes and the small lymphocytes, which will differentiate into T and B lymphocytes. And the B lymphocytes are the precursors of plasma cells. These are the lines of production of the cells of the blood. The protein components or the protein elements in the blood are produced mainly by the liver, and the erythrocytes' lifespan is approximately 120 days, degraded in the spleen and in the liver by cells called the von Kupffer cells. The liver also clears proteins and lipids, amino acids, and the kidney secretes waste products into the urine. The color of the blood, the hemoglobin content is responsible for the color of the blood. Also, the hemoglobin interactions with different materials is responsible for the color of blood. It has 4 heme groups or 4 iron groups, and the arterial blood and capillary blood is bright red because it's oxygenated. The oxygenated blood appears bright red more than the dark red color of the deoxygenated blood present in the veins. And this is evident during blood donation. Of course, you will see dark blood coming out of the veins. The difference in colors between the oxygenated and deoxygenated blood, or the arterial and venous blood, is due to the fact that the spectrum of light absorbed by hemoglobin differs between oxygenated and deoxygenated forms. Also, some other factors affect the color of the blood, like carbon monoxide poisoning, for example. With the formation of carboxyhemoglobin, the bright red color of the blood is there. Also, in cyanide poisoning, because the cyanide poisoned patient cannot utilize oxygen anymore, so the venous blood remains oxygenated, so increasing the redness instead of being dark. Also in cyanosis, Cyanosis, due to certain conditions, can make the skin appear blue. If the heme is oxidized, methemoglobin forms, and which is brownish in color and cannot transport oxygen. Also, in rare cases of sulfhemoglobinemia, arterial hemoglobin is partially oxygenated and appears dark red in color. Veins evident near the skin appear blue. This is because of the light scattering properties of the skin and the processing of visual input by the visual cortex rather than the color of the blood itself. Of course, the color of blood is not blue. Now, for the blood types, we have two systems: the ABO blood group system and the RH, or the rhesus factor system. The ABO blood group system depends on the presence or absence of antigens. And the antigens, the A antigens and B antigens. Blood which has A antigens is classified as group A. With B antigens is classified as group B. With A and B antigens classified as group AB, and with no antigens at all classified as group O. Now, the group A blood has A antigens but has anti-B antibodies, which are immunoglobulin M antibodies. The group B has anti-A antibodies, and the group AB has none antibodies. Group O has anti-A and anti-B antibodies. Because group AB has no antibodies, so it's a universal recipient, can take any type of blood during transfusion. And due to the fact that group O has no antigens, it's a universal donor. Well, it has, of course, anti-A, anti-B, but the amount of blood transfused will not replace the whole blood in the patient. It will give minimal reaction or none at all. The other system for blood grouping is the RH, or the rhesus factor. It depends on the presence of antigens defined, 49 defined blood group antigens. The main antigens are D and C and small c, with E and small e are the most important rhesus factor antigens. And the determinant of positivity or negativity of blood, like when you say that someone has an A positive blood or A negative blood, depends on the presence or absence of the RHD only. So RHD is the main factor that determines the presence or absence of rhesus. For the individual to be positive or negative according to the RHD antigen only. Antibodies to the RH antigens can cause hemolytic transfusion reactions, and also it plays an important factor in pregnant women in a case called erythroblastosis fetalis, or the hemolytic disease of the fetus and newborn. If this is evident, the mother attacks the blood of the baby, and so she takes an injection to overcome this discrepancy in the rhesus factor status between the mother and the fetus. Also a hint about the lymphatic system. Of course, you know that lymph is the ultrafiltrate from the tissues, and what's left over by after the exchange or the passage of blood in the capillary bed, collected by slow system called the lymphatic system, collected by very tiny or minute ducts that collect into bigger ducts and eventually into right and left main ducts. The left main duct is the thoracic duct. Right main duct collects lymph from the upper quadrant, right quadrant of the body, and both of them, they empty their contents of lymph into the subclavian vein, so back to the systemic circulation again. And we will talk about lymph in little details in the coming lectures. The next lecture will talk about some details of the cells that constitute the blood, like the RBCs and the white BCs. I hope you got the maximum benefit from this lecture, and thank you very much for watching.